Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to do another case study. It's going to be over prioritization, and this is part two. If you haven't watched part one, that's fine. It doesn't go in any particular order. You can watch this and go back and watch part one because it's lots of important information for you. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it, so go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, part one, part two. You can sign up for a private tutoring session or a consultation session with me. Maybe you might want to pick my brain about something. Or if you're a current student, I have audio lessons available. If you are not doing so well and you just really need that push to get you to the next level, be sure to check out the audio lessons that are available on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, right here, YouTube. My handle is the same everywhere. Now, without any further ado, guys, let's get started. So take a look at this case study. It says that you're the nurse working on a busy medical surgical unit. You are assigned 5 patients. Here are your patients. The first one is Mr. Alex Cooper. It's a 72-year-old patient recently diagnosed with acute myocardial infarction, MI. He's on a heparin infusion and has a continuous cardiac monitoring system. He reports chest pain, nausea, and shortness of breath. Ms. Judy Green, a 45-year-old post-op day 3 after a lap chole. She's receiving IV fluids and oral pain meds for moderate post-surgical pain. She's ambulating well and has no signs of infection. Then you have Mr. Richard Lee. This is a 63-year-old admitted with severe chronic obstructive pulmonary disease exacerbation. He's on a non-rebreather mask with oxygen and requires frequent suctioning due to copious secretions. His O2 sats fluctuate between 88% and 91%. Next, you have Ms. Carla Harris. This is a 25-year-old newly diagnosed type 1 diabetic patient. She's admitted with DKA and is receiving IV fluids and insulin. She's alert, but her blood glucose levels have been erratic and she requires frequent monitoring. Last, you have Mr. Parker, an 80-year-old with advanced Parkinson's disease. He's nonverbal. He cannot walk independently. I can't speak. He cannot walk independently and has a G2 feeding. He's on comfort care measures and his family is at the bedside. So guys, take a second to look at what's going on with your patients. All right. So my first question to you guys, which patient are you going to assess first based on the clinical findings? Out of these 5 patients, who are you going to see first? And the correct answer is Mr. Cooper. That's who you're going to see first. Now, if you guys just watch my priority case study, part 1, right? We had a patient that was in DKA, and that was our priority. Here, we also have a patient that's in DKA and they are not the priority. And this is why I keep telling you guys in nursing, you cannot memorize. Don't try to memorize answers because what's correct for one question will be incorrect for another. What's correct for one situation will be incorrect for another. You have to be able to think critically, guys, right? So how come in this situation, even though we have a patient that is also in DKA, and I did that on purpose, that is also in DKA, they're not the priority patient. This patient with the MI is a priority patient. Again, whenever we're talking about priority, the priority patient is always going to be the patient who is at most risk. When we look at Mr. Cooper, this is a 72-year-old, came in with MI. He's on heparin infusion, continuous cardiac monitoring. He reports chest pain, nausea, shortness of breath. What are those signs and symptoms of? Maybe this patient's having another what? MI, right? Don't you think that is more lethal than my patient with DKA? Let's go to the 25-year-old Miss Carla. She's a newly diagnosed type 1 diabetic. She's admitted with DKA. She's getting IV insulin fluids. She's alert, but the glucose levels have been erratic and she requires frequent monitoring. Her glucose levels have been erratic. They're erratic, but we don't even know what they are. Who with just the information that we're given, who's most at risk? The MI by far, right? Okay. Next question. Which of the following is the most critical action to take for Mr. Cooper? So we've established that Mr. Cooper is our priority out of all the patients that we're looking at. Okay. My question is, what is going to be the most critical nursing intervention for this patient? Is it going to be to administer morphine for pain relief? Is it going to be increase the rate of heparin infusion? Is it going to be obtain an ECG or to encourage him to deep breathe to reduce anxiety? Again, we're talking about Mr. Cooper. Which of the following is the most critical action to take for Mr. Cooper? Here are your options. Administer morphine for pain relief, increase the rate of heparin infusion, obtain an electrocardiogram, that's the ECG, or encourage him to deep breathe to reduce anxiety. And guys, the most important thing to do is the ECG. Why? The patient is exhibiting those clinical manifestations of MI, but guess what? We have to confirm it, right? You have to set assessing is anything that you do to get information. I'm telling you this right now, guys. The minute you see a test question, and usually if this is NCLEX, usually it's going to be a scenario where you are the nurse working as triage in the emergency room, and a patient comes in with chest pain. What do you expect to be ordered? What do you expect the first thing that you're going to do? And it's always going to be what? EKG, ECG. That's what you're going to do. Patient has chest pain. We think they're having an MI, but we have to assess. We're going to assess for ST elevation, arrhythmia, ischemia. How are we going to do that? ECG. Okay, look at the other options that I gave you. The first option was administer morphine for pain relief. Yes, most likely this patient is having an MI, and yes, morphine, absolutely. But guess what? We don't know yet. We haven't assessed. So that's not the first, because remember, this is multiple choice. You can only choose one answer. So your one answer is going to be the first most important thing that you're going to do. So that's why we didn't choose morphine. The next option was increase the rate of heparin infusion. Oh, we're playing healthcare provider now. We haven't even assessed. We don't know what's going on with our patient. We're going to do a nursing intervention and step outside of our scope of practice? Absolutely not. And then choice D, encourage him to deep breathe to reduce anxiety. Let me tell you something. When it comes to anxiety and nervousness and any feelings or thought process that the patient has, that comes later. We have to address the patient's physiological integrity first. We have to make sure that patient's alive before we're concerned about their anxiety. So we would not choose that. We're going to do that ECG. All right. My next question to you. Miss Carla. So we're talking about patient number 4, Miss Carla Harris. Miss Carla Harris's blood glucose is now 500 milligrams per deciliter, and she's showing signs of dehydration. What's going to be your immediate priority? Would it be to increase the rate of IV insulin infusion? Would it be to administer a bolus of normal saline? Would it be to prepare for a potassium replacement? Or would it be to administer an oral dose of insulin? I'm going to repeat what's happening to Miss Carla Harris. Miss Carla Harris's blood glucose is now 500 milligrams per deciliter. She's showing signs of dehydration. What are you going to do? Increase the rate of IV insulin infusion, administer a bolus of normal saline, prepare for potassium replacement, or administer an oral dose of insulin. What are you going to do? And I hope you all chose administer a bolus of normal saline. Look at what's going on with Miss Carla Harris. This patient is in DKA. And if you already saw my first video, the case study about another patient that was in DKA, what did I tell you is a priority for this patient? Dehydration. Dehydration and the effects of dehydration on the body will kill you faster than the hyperglycemia. Right? When you are hyperglycemic, your body has so many mechanisms where it tries to compensate, right? You're going to have polyuria, you're going to have polydipsia, you're going to have polyphagia. Your body's trying to compensate. But fluid and electrolyte imbalance, and that is called one of the causes is dehydration, right? Dehydration has so many complications that will harm you so much faster and worse. So that is what we have to correct. And then in the question, let me repeat the question to you. I said Miss Carla's blood glucose is now 500 milligrams per deciliter, and she's showing signs of dehydration. I told you what the problem is. She's showing signs of dehydration. That's what needs to be addressed. But guys, even in the question, even if I didn't tell you that she's showing signs of dehydration, even if I did not mention the word dehydration, look at what's going on with Miss Carla. She's in DKA. She's in DKA, diabetic ketoacidosis. She's getting insulin fluid. She's alert, but her glucose levels have been erratic. Oh, you know what? I thought I put something else in there. I didn't. But so that point I was going to make, never mind. But anyway, in this question, I told you that patient is dehydrated. I told you what the problem is. That's what you're going to assess. You're going to give that patient fluids. Let's talk about the other options that I gave you. The first option was to increase the rate of IV insulin solution. This patient absolutely needs insulin. Okay. That's not a question. They're at 500. However, when you have to choose between the two, giving insulin to the patient who has a glucose of 500 or hydrating that patient that's in hydration. Why? Again, dehydration will kill you much faster than hyperglycemia. Your patient that's dehydrated, that their fluid electrolytes are out of whack, those complications from dehydration will put your patient out much faster than a hyperglycemic episode. So I'm not saying the hyperglycemia is not important. It doesn't need to be addressed. It's just not as important as a dehydration. Okay. The next option, prepare for potassium replacement. Where in this situation did I even mention the patient's potassium levels? So you're just going to go ahead and give that patient potassium without checking their current levels? Now, granted, we understand if a patient's in DKA and we're treating that DKA, we're giving that patient insulin. We understand that insulin pushes potassium out of the cells. We understand that insulin can cause the patient to be hypokalemic. We understand that hypokalemia can cause cardiac dysrhythmia. So that's a big issue. But we can't assume we don't know what that patient's potassium levels are. We haven't checked. So that's wrong. And the last option that I gave you was administer an oral dose of insulin. If you chose that, you let me know you have no idea what you're talking about. Oral dose of insulin. Since when is insulin given orally? Never, right? That hydrochloric acid in your stomach will tear that insulin apart, cause that insulin to be ineffective. It will do nothing. We don't give insulin orally. So that could not have been your answer. So you're going to address the problem, which is dehydration. All right. Before I move on, remember that patient that's in DKA, they are spilling ketones in the urine. You test the urine, you see they're spilling ketones. And guess what? There's a whole lot of urine going on. That's part of the reason that patient's dehydrated. Okay. Next question. Miss Judy Green is ambulating well, but reports a mild fever, about 100.5, and mild tenderness at the incision site. What are you going to do? Are you going to assess the incision site for signs of infection? Are you going to administer an antipyretic such as acetaminophen? Are you going to document the findings and continue to monitor, or are you going to notify the healthcare provider immediately? Let me repeat that. So we're talking about Miss Judy Green. That's her second patient. Okay. Miss Judy Green is ambulating well, but reports a mild fever of 100.5 and mild tenderness at the incision site. What is your next best action? Assess the incision site for signs of infection, administer an antipyretic such as acetaminophen, document the findings and continue to monitor, or notify the healthcare provider. And I hope you all chose assess the site. assess the site. Now, on that last case study I did, we had another patient that just had surgery, and I explained to you any patient that had an invasive procedure, you're going to be concerned about infection, you're going to be concerned about DVT/PE, you're going to be concerned about hemorrhage. I explained that already. But something else I also mentioned that I want to mention in this video, timing is important. If it's within the first 24 hours, it's not likely that that patient's exhibiting signs and symptoms of infection. Most likely that patient's either hemorrhaging out, they have a DVT or pulmonary embolism. But after that first 24 hours, yes, infection definitely is a risk factor and it's very likely. Take a look at what's going on with Miss Judy. It's been how long? 3 days. So absolutely, we're going to be thinking about infection, right? After that first 24 hours, there's absolutely a higher risk of that patient having infection and exhibiting those signs and symptoms. So, we're going to assess the site. Now, let's look at the wrong answer choices. Administering an antipyretic such as acetaminophen, yes, we may do that, but remember, this is multiple choice. You could only choose one thing. The one thing you're going to do is assess. Next, document the findings. Let me tell you something. You never document if something's wrong. If something's wrong, there's something acutely happening, you're going to address that situation. You're going to be performing a nursing intervention. You don't document until your patient's stable. So we're not going to do that. And last, notify the healthcare provider immediately. You're going to notify the healthcare provider to say what? What are you going to say? You have no vitals. You can't even tell the healthcare provider what that wound looks like. If there's drainage, you can't say what the drainage looks like, what it even smells like, nothing. You haven't assessed them yet. So the first thing you're going to do is get information. You're going to assess. All right, next. Mr. Robert Parker, who's in the end stages of Parkinson's disease, appears restless, and his family is concerned about his comfort. What's going to be your priority intervention? Are you going to administer a dose of pain medication? Are you going to reposition him to a more comfortable position? Are you going to assess his vital signs to check for signs of distress? Or are you going to provide emotional support to the family? Again, we're talking about your fifth patient, Mr. Robert Parker. That's in the end stages of Parkinson's disease. He now appears restless, and the family's concerned about his comfort. What are you going to do? Administer a dose of pain medication, reposition him to a more comfortable position, assess his vital signs to check for signs of distress, or provide emotional support to the family. You're going to check vital signs. We need to know why that patient seems to be in distress. Let me tell you something. Um, Whenever you see a change in a patient's cognition, we don't know what's wrong, but we know something is very wrong. And usually that's going to be your priority patient. So when you see a sudden acute confusion, disorientation, irritation, agitation, lethargy, right? Something is wrong. We don't know what's wrong. That's why we have to assess them. You're going to assess, you're going to get information. Now let's look at the wrong answer choices. Administering a dose of pain medication. You give a patient medication when they're in pain. How would you know that they were in pain if you didn't assess them yet? Next, reposition the patient to a more comfortable position. That's a great thing to do, but the first thing you're going to do is assess. You don't even know why they're not comfortable. And last, providing emotional support to the family. The family's not your patient. Your patient is the patient. Okay. Last question. Which patient is at the highest risk for a critical event if not monitored closely during your shift? Would it be Mr. Cooper, Miss Harris, uh, Mr. Lee, or Parker? Cooper, Harris, Lee, or Parker. Which patient is going to be at the highest risk for a critical event if not monitored closely during your shift? And I'm sure you guys all got the correct answer. It's going to be Mr. Cooper. We're concerned about the MI. He's already come in with the MI, right? We're concerned about that patient going into what? Cardiac arrest. They already came in with an MI. We're concerned about them going to cardiac arrest, arrhythmias, ischemia. That is a patient that is going to have the highest priority, is going to be monitored most closely. And guys, that is it for this case study. Please oh my gosh, I can't speak. If you're new to my channel, I apologize. I have a speech impediment. I've had it forever. I can't help it. Forgive me. I'm sorry. But anyway, guys, that's the end of this video. Let me know what you thought about this video. Let me know what kind of case studies you would like to see in the future. And if there are anything besides case studies, if you like to see me cover something in a different format, maybe a Kahoot, maybe a Q&A, maybe a lecture. However you'd like to see me cover the information, please let me know. I'd be more than happy and willing to do that for you. So just let me know in the comment section. Don't forget to check out my website, nexusnursinginstitute.com. Guys, thank you so much for watching. You guys will catch me on the next video.